Hi everyone, I'm doing a quick video on medication administration, and the point of this video is I want you to observe my process, and that way I can also give you an example of how to give medication administration for your validations. Um, so what I want you to do, I'm going to show you what the process is according to the checklist. So please get out your checklist and try to follow my lead. And as a group, what I want you to do is try to critique what I'm doing, and then we'll get back together after you guys review the video and talk about the video. We'll talk about the critiques about what could I have done better, what I did well, and then we'll talk about the role of the nurse when it comes to these medications. All right. So first step is we're always going to look at our order. Now, when we're looking at medication order, I'm going to give you an example of a medication order. Here we go. Let's start with this one. This is one from Cerner, and I have it zoomed in a little bit because if not, it doesn't come out clear. But if you notice in the top, you'll see the name, and it should come out clear typically. Oh, there you go. You'll see the patient's name. You'll typically see their date of birth, if they have any allergies, and also another number, like what we call a visit number, or a FIN number, or a medical record number. So that's how we're going to validate that this is the right patient. So remember, we're always going to follow the 5 basic rights. When you look in your book, there's about 10 rights. But for now, to give medications, it's 5 basic rights. So we're always going to look at the right name. Okay, look at the drug, the dosage, the route, and the time. Now, when we validate everything, we're going to plan ahead. We're going to look at the medications. We're not going to go by these medications. We're going to go by the little template that I made for you guys. We're going to administer 2 medications. One is omeprazole, 20 milligrams oral daily, and the second one is diphenhydramine or Benadryl, 50 milligrams oral twice a day. So before we walk into the patient's room and do a quick assessment and let them know that we're going to give them medications, we're going to look at what are the side effects, or is there anything we have to look at. For example, if one of them was an antibiotic, which they're not, we'll look at the results of the culture, maybe their recent vital signs to see how's their temperature. In this case, omeprazole, it'll be based on our assessment. We'll take some vital signs when we're in the room. We'll do a GI assessment, ask the patient have they any heartburn, and then diphenhydramine, we're going to see, first of all, a lot of times this medication is given as needed, but in this case, some patients do take it once a day or twice a day. Maybe they're very allergic. And quite honestly, this is the only 2 medications I give you a good example of because I have actual copies here. So what I'm gonna do is I'm gonna use my daughter again as the actress, and she's gonna be very lovely. So we're gonna walk over and assess our patient, and then we'll come back, pull the medications, and go through our 5 rights. So here we go. Xavier got home. I heard him. There you go. Want to point it to the patient. So I'm gonna knock, introduce myself. I'm Professor Joey, your nurse. Hello, guard dog. How are you, guard dog? How are you, ma'am? How you doing? Oh, wash my hands. Where's my little hand sanitizer? Let me verify I'm seeing the right patient. So what is your name and date of birth? Well, do you have any allergies? No. Alright, so I'm here because I'm going to do a quick assessment because I'm going to give you a couple medications. And I just wanted to see how you're doing and if you had any questions, okay? So the 2 medications I'm giving you is omeprazole, 20 milligrams, and that's a medication for your heartburn, for your stomach. And then my son's crawling. And then diphenhydramine, you might know as Benadryl, which is for your allergies because you are a very allergic girl. That's why this dog is always all over you. Do you have any questions about your medications? So side effects include for Benadryl is you're gonna get drowsy. It typically makes you sleepy. Maybe not if you're used to taking it twice a day according to the order. You're probably used to it. But it also make you a little constipated, which is no surprise there. And then the famotidine, the omeprazole. Which medication was I talking about again? The famotidine, which is also known as Pepsid, can also give you some GI issues, some stomach issues, and also can give you little constipation, but the purpose of this is to relieve your heartburn. A lot of times that's what it's for. So do you have any heartburn right now? No? That's probably because you take it every day. Because you have a good nurse giving you all the medications on time all the time.
What's the nurse's name?
Professor Carolero.
It's Mommy.
Either way, do you have any other questions about your medications? No, you have no more questions. Anyways, so I had someone take vital signs for you, and so I have your vital signs on my list already. So let me ask you a couple of questions. Do you have any nausea or vomiting? Any problems with your stomach? No. Nothing. No abdominal pain. No nausea. No vomiting. When was the last time you had a vomit? When was the last time you pooped? You don't have any diarrhea or constipation, do you? No? Okay. How about your allergies? Do you have any rash? Do you have sniffles? Do you have anything having to do with your allergies? And then you have your support dog with you. I wonder what's the problem. Okay. So if there's no other questions, I'm gonna go and get the medications and bring it back to you, okay? Okay? Alright. So wash my hands on the way out. And then close the door behind me. That's the door being closed. Alright, so here we go. Now we're gonna go back into the med room and we're gonna grab the medications. So what we're doing now is we're gonna look at the order. Let me switch over to the order. So you see, well, the patient is not Joey Carolero, it's Gianna Carolero. Either way, date of birth, that's my birthday. So we'll confirm the fin date and then see if there's any allergies. So right there, I'm looking at the name and birthday, so I'm confirming the name. This is the right patient, the one I just walked into the room, checked their armband. This is the correct patient, the correct birthday, the correct birthday, and then we have a correct fin number. All right, so again, we can also check allergies, and then we're going to look at the medication, the right drug, omeprazole. So we'll look in our cabinet or in our machine, and we'll pull out omeprazole. So I will pull out the omeprazole, and I will pull out the diphenhydramine. Now, I have the two medications here. We'll look at the diphenhydramine first. No, we'll look at the omeprazole first. So the omeprazole comes in a bottle. If you look closely, you can see what the dosage is. And real closely, you see it says 20 milligrams. It might look reversed, but I promise you, it's 20 milligrams. All right. So now we'll look at the medication order. We're gonna look at the right name, look at the right drug. We have omeprazole, 20 milligrams, which is one tab. So we'll take our 1 milligram and we'll put it in our little medicine cup. Oh, there we go. So we'll put in a little medicine cup, and then we'll get the other medication, the diphenhydramine, and we'll get it ready. So now, the first thing you want to do when you have the medication in your hand is you want to make sure it's not expired. So for you to check if expired, just check the package. And this one does not expire to 5051. It's 2021. So this medication has not expired. The next one, which is a lot of the ways you're actually going to see your medication, will be in these little packets, individual packets. Very seldom will you see them in a bottle this way. You see the wardrobe, you see the expiration and the date. Expiration date here is July 2022. So we know they're not expired. That's the first step. That's apart from the 5 rights, even though I believe that's one of the 5 rights when you look at the book, but you want to look at that one. So we'll look at the medication list again. Omeprazole 20 milligrams, confirmed, oral and daily, which is the time is now to give it. And then Benadryl, it says 50 milligrams. But the thing is, if you look closely, this says 25 milligrams. So I got the right medication, the right drug. All right, do we have the right dose? If I just had one, do we have the right dose? No. This is 25 milligrams, I need 2. So that's why we have 2 of them here, 50 milligrams. So correct dose now, and then oral. and twice a day, and the time is not to give it. Okay. Now that I have that confirmed, now that I did that check once, I just went through my 5 rights once. I'm going to do it a second time before I walk into the room. So we'll do it one more time. Do we have the right patient? Gianna Carolero. This is her birthday. This is her FIN number. And she doesn't have any allergies. Now, omeprazole, 20 milligrams oral daily. So the time is now to give it. So the right name, the right drug, omeprazole. We got 20 milligram capsule, which the order is 20 milligrams, and we're going to give it oral daily. Second one, diphenhydramine, 50 milligrams. I only have 25, so I have to get 2 of them, and it's oral, and the time is now to give it. So we did 2 checks before we walked into the room. All right, we make sure the medication is not expired. We did a quick assessment. Now we're ready to give the medication. So we're gonna walk back over. And we're gonna knock again, ask to enter. Now at this point, she knows who I am. I've already done an assessment. I walk into the room, but hey, it's Professor Joe again. How are you? All right, let me validate who you are. Name, oh, thank you. So remember, I have to wash my hands. Thank you, patient, because patients are afraid of COVID. Anyways, name and date of birth. Any allergies? Okay, so I have the medications here to give to you, okay? The ones that we talked about. Do you recall the medications we talked about? What are the medications that we talked about? Close enough. Close enough. So let's go through the check. All right, so we're gonna look at the medication order one last time at the patient's bedside, and this is where typically in the hospital you will have the computer in front of you and you will do the scan with the medication. So when you're scanning with the medication, it'll show you if it's the correct patient, because we'll scan the patient's barcode on their armband. Then we'll scan the medication, and the system will show you if it's the correct medication or the incorrect medication. Very important that you have to look at the screen when you're scanning, because a big stop sign or something red, something that's going to get your attention will pop out and show you if it's the incorrect patient or the incorrect medication. If not, usually the color is green when it shows you it is correct. I say this because there has been nurses that they scan the incorrect patient or the incorrect medication, don't look at the screen, administer it, and don't realize it was the wrong medication until afterwards, where they go to hit document. Either way, at this point we'll we'll get some water. We'll get a cup of water. Okay, in this part we'll give her a bottle of water. We did our scans. We did our 5 checks. We checked her name. We scanned the medication. The medications are correct. Her dog is freaking out, and it's the correct route, and all her questions are answered. So this is when we'll give her the medication. Now, when we give her the medication, remember, there's a lot of older adults that you're taking care of, so you want to give them the medicine cup with the medication, and and want to make sure they drink the medication. Remember, a lot of the linen is white, and a lot of the pills are white, so you make sure it goes into their mouth and make sure they swallow it. Now, some patients that maybe don't want to take the medication, you're going to have to ask them, let me see your mouth. Did you get to swallow it okay? Or some don't swallow well and it stays in their mouth, and you're going to have to give them a little more water, or probably give them some pudding to help them, depending on the medications, to help them swallow it. So then after everything is done, then we'll go back. We'll go into our system, and then we'll hit document. You do not hit the document button until the medication is given. Thank you, ladies. So that's it. That's it in a nutshell. How to give medication safely. You go into the room. You review your medications. You do your assessment based on the medications you're going to give. You walk back out. Make sure you wash your hands on the way out and back on the way in, like I just did. And we'll do 2 patient checks of the 5 rights outside of the room before we go into the room. And we're going to note the expiration date. Then when we're in the room at the patient's bedside, we're going to check one last time. So we check 3 times before we give the medication. If you're not checking 3 times, you're doing it wrong. All right? And then, of course, give the medication with water. make sure they swallow it, then document the medication. And of course, you always want to follow up depending on the medication it is, 30 minutes after, an hour after, and do your evaluate stage. Remember, we always go through our nursing process, and we always have to reassess at the end. All right, that's it. Hope you find some interesting little holes that I left for you. I wish you the best of luck.